followers, your boy Trey Retro _GT back for another episode of the G.Taylor Show. Hope that your week has been well. Please like, share, subscribe to the G.Taylor Show. Road to 1,000 subscribers. Also like, share, subscribe to the podcast. All available on your digital streaming platforms as well. If you haven't already, hit both of them. You know what I'm saying? So we can be good to go. So listen, talked about a few content areas. Getting back to the swing of this content thing. Hopefully everybody's is enjoying the episodes. Again, let me know how you feeling and other topics that you want to discuss. I got a little timeline we're gonna rock with going through the summer. Hopefully we can knock these things out, keep it moving, right? But today I want to talk about something else. I want to kind of get into some of my research and what's been happening going forward. So I'm gearing up to look at possibly doing some leadership consulting for human service organizations in rural areas. So I grew up, reside, and grew up. Let's say I grew up. I was raised and grew up and reside in a rural area and community. Luckily, we are a grown community at this point in time. But if you come to my home, you'll see that. Please don't come to my home unless uninvited. But if you come to my home, I live in a very rural environment. When I had my homeboys come out here, man, they was like, man, you are definitely back in the sticks. But I ain't too far in the sticks, you know what I'm saying? But I enjoy this peace of mind of being in the sticks. I was born and raised this way. Brings me peace, and I'm able to step outside, and I don't have too many condensed neighbors on top of me. I've lived in the suburbs. I lived in the townhouse. I lived in the HOA neighborhoods. Although amazing start to home ownership and all the other perks that you get with that, it's just not for me per se. But either way, outside of being born, raised, and continuing to reside in this area, I also worked in the healthcare setting. Most of my start has been in the healthcare field. Even though I was in food service in the healthcare setting, I always worked at a hospital or a healthcare setting most of my career, whether that's, here in Fredericksburg, Virginia, in Richmond. I was working at some form or fashion in a healthcare setting. So I've been around healthcare forever. And once I maneuvered into mental health care, and then also in social work, things started to shift a lot. And so I was able to witness and see the other side of healthcare from the rural perspective. And then also when I worked in cities like Richmond, I was able to see the difference in how we go about getting access to healthcare and rural healthcare from the rural perspective, but also the urban perspective. And that was very informative of the work that I do and how we talk about mental health in this country, but also how we talk about mental health in the state of Virginia. And so some of my research looks at, addressing those mental health disparities in rural communities. And for a lot of us, at least when I talk to folks about my upbringing, like I tell them that I didn't have high-speed internet until about 2011, 2010, probably most of my undergraduate career. And we had just got, probably the last year before I graduated, just got high-speed internet, which is a barrier, right? We start talking about, and you think about all of the virtual therapy that's a thing now. But at that point in time was just like almost like a luxury at that point, right? And sometimes insurance wasn't even, actually addressing it until we had the pandemic. The pandemic shifted a lot of things for folks, especially in rural areas. And so there were a lot of mortality rates as a result of the pandemic, but then also as a result of access to care, right? And access to health care is a big factor of comorbidities and mortality rates in rural environments. And rural can be these spaces where considered non-metropolitan areas that are non-sparsely populated and have different unique characteristics throughout the country. Every rural community is different, it shifts, and they have their own unique characteristics. They might share similarities between, gaps in access to healthcare, mortality rates, morbidity rates, insurance barriers, financial issues, poverty, income insecurity, things like that, right? Transportation as well. But then you start talking about who's there and who gets affected the worst, then we have another conversation. So when I start talking about this piece of the Black community in rural areas and how they suffer double time, one of the articles talked about the double jeopardy, right, of being during the pandemic where you were Black but you were living in a rural environment. So not only were your comorbidities increased because you were black, right, due to those health disparities as black folks, but then it was double the fact because you also lived in rural environments. And that's a reality for a lot of folks in these different and who live in rural environments who maybe not have the resources or access to care that they need, whether that's the income, the insurance, or even ability to go to a hospital, go to a doctor in their area. And so I felt as though, okay, that if that's the case, then how can we help? How can we, you know, meet these people where they are at? How can we address the individuals who lack transportation, lack access to internet, may not be able to afford, you know, healthcare and or afford treatment, but are isolated and suffering in silence, right? And obviously, Medicaid expansion was one way to combat that, right? But as we can see now, there have been major cuts to Medicaid that is also making it even more, making it tougher for folks to access that care, which they once did, right? But even in the midst of that, there were still barriers going on where we expanded access to Medicaid in those areas, but folks who didn't have transportation, you can call it Medicaid cap, but Medicaid cap could only go but so far, especially in these deep wooded areas, or you have to set it up in a certain period of time. All these different aspects, these contextual factors that impact folks who are living in rural environments. And so when we think about that, we think about the rural barriers. We think about the specific rural barriers based upon the location, state, locality, geographic location, what that looks like. And we think about the needs assessment of what our communities are needing in rural areas. Because again, rural areas differ between the states and different geographic locations. So I focus mostly on southeastern part of the United States. Due to the black population and a lot of folks who have black historical roots in those different areas, as well, because when I thought about rural and in general, and I thought about maybe like rural Appalachia, that their set of barriers looks a lot different than my set of barriers here in this part of Virginia. And that's a whole different aspect of transportation barriers, maybe, you know, when we talk about Appalachia, housing, income, you name it, right? And so again, it's varying levels when you start talking about rural health and rural mental health. I don't think it's a one size fit all approach, and I think that's where we need to understand that when we start talking about interventions and approaches to helping folks in rural areas, that we have to make those interventions specific to that area. Can we replicate and build off of something that might have been successful in one rural area to another rural area? Sure. But those unique characteristics or traits have to be embedded in that intervention that we do when we are taking that said thing to that rural community. Now, when we start talking about black and brown communities, that's even more important because now we're looking at the cultural aspects and those cultural contextual factors that play a role in how those barriers are addressed or not addressed, and how those interventions are implemented or not implemented. One of the biggest examples I've had is like when you come to work in Caroline, if you want to come work in Caroline County, if you're not a resident of Caroline County or have family members or from Caroline County, it's harder to build the trust and rapport, and you have to immerse yourself into the community, especially the black community, to build that trust, safety, and rapport. But if you're just going in there because you see a gap and because you see an issue that you want to address and do not connect with the community leaders in that community, you're not going to be successful. I've seen it happen in real time, and it was fascinating to watch because I thought we had a good connection there, and it dissolved and fizzled out so quickly. You have to be immersed in the communities that you are looking to serve. Even if you have a great intervention, you have great resources, things that can transform. If you don't connect with those community leaders who already had trusted buy-in from those communities, that have established safety and rapport with those communities, it is going to be hard to implement those things in those spaces, right? I reside, and grew up in these different areas in my area that I currently work in, and it's also tough because I can't serve everybody because I know everybody. I'm even related to somebody. My wife related to somebody. My mom know this person. My dad know this person. You name. My grandma knew this person, right? So with the situations of code of ethics and boundaries and therapeutic and client relationship, I can't provide all those said services, right? But I can, be a catalyst in helping connect folks. I can be a catalyst in providing psychoeducation. I can be a catalyst in helping organizations, healthcare organizations, possibly that are looking to come in to help serve specific unique populations considered in these different rural areas. And so I think that's where we have to be specific at, is understanding how do we address the rural disparities that are happening across the country in different areas in the United States, and then how are we also being strategic and unique with what those actual needs are specifically. Understanding that funding is being stripped left and right, day and night, all the time, and fighting for that, we also have to speak to the specifics of these different communities and what they are needed in those moments. And if we don't, then we lose the opportunity to help provide the solutions that's necessary for a diverse group of people that live in these different areas. And when we think about diversity, we always think about, I think we always think about sometimes ethnicity, but diversity goes way deeper than that. It looks at, race, gender, sexuality, sexual orientation, income inequality, SES status, you name it, is so diverse in that aspect. And so how are we showing up for those individuals who have multiple positionalities that impact their access to care and access to resources needed to be, I would say, in a from the social determinants of health lens, to be able to live a socially healthy life, right? And to be healthy from the spaces that they work, live, and interact with socially on a daily basis. And that's one of the things that I left out of my last piece of my capstone. Is I started with the social determinants of health and social determinants of mental health, kind of looking at it from a public health standpoint, and kind of got away from it towards the end. But that's one piece of understanding that what are the determinants of health for folks where they live, work, and socialize at on a daily basis. How does that impact their well-being, their health outcomes, their mental health outcomes? And for these different areas, especially in rural areas, who geographically make you feel like you're isolated, or it takes 30-40 minutes to get to the next hospital, that's a problem that needs to be addressed locally versus a 30-40 minute ride. It's one of the reasons why initially we moved out of the area, because when we were having our first child, my wife wanted to be closer to a hospital and I wanted to be closer to a hospital. And at that point in time where we were staying, we didn't have high-speed internet. And so there were some concerns that we had as first-time parents, that we like, all right, well, if this happened or this happened, I might be on a call, you might be over here. We want to be as close as possible at that moment, and that was one of the reasons we moved out. But we came back, and some things that we still have to be aware of in those moments. So I think for leaders, especially human service organizations and leaders of human service organizations, thinking about not just what you're trying to bring to the table and the intervention that you're trying to address in these rural areas, but what are the unique characteristics and traits of that community that you're trying to serve that is being overlooked or underutilized? And are you connecting with those community leaders who may have already been doing the work, have done the work, but need an extra hand in getting that to everybody? If you do not do that, those things that you're trying to bring to that community won't work. And I've seen it happen firsthand. So, like, share, subscribe to the podcast. Let me know what you think. Make sure you like, share, subscribe to the G.Taylor Show. We are on YouTube, road to 1,000 subscribers. Tongue-tied today. But looking forward to seeing you. Drop a comment below. Any questions, comments, any other topics you want to discuss on that aspect, please reach out and let me know. Other than that, I hope you have a wonderful week. We'll talk soon, and take care.